Hello, everyone. Welcome to the Doctor of Psychology and Clinical Psychology virtual information session, the PsyD virtual information session. We appreciate everyone's time this morning, and we want to just thank you for taking time out to want to learn more about our PsyD program here at the University of San Francisco. Please feel free to ask questions throughout the presentation. There's going to be an area, you should see an area on the right-hand side of your screen where you can type in questions. And we will have time at the end of the webinar to respond to your questions. Just to let everyone know that this webinar is being recorded for those that would like to take some time to review the information again. And it will also be posted on our website. I'd like to introduce myself. My name is Carolyn Arroyo. I am the Graduate Enrollment Manager for the School of Nursing and Health Professions at the University of San Francisco, and I will be moderating this information session. And now I'd like to introduce a presenter, faculty member in the PsyD department, Dr. Delanira Garcia.
Good morning, everybody. Thank you for joining us, and I'm excited that you are wanting to know more about our very exciting program. So I will be walking you through some information. Please ask questions. This is the time to get questions answered, and I'm happy to answer those as best I can. If for some reason you ask a question and I don't know offhand, I will absolutely look into that for you and get back to you. Okay, so we'll go ahead and start. So, and just to briefly introduce myself, my name is Dr. Garcia, and I'm one of the core faculty in the PsyD program. And I teach a variety of courses in our program. I teach, for example, this semester I'm teaching culture and mental health, quantitative research methods and design, and I'm doing some field immersion experiences, and I also teach dissertation seminars. So just to give you kind of a breadth of some of that, some of those courses. So let me tell you a little bit about our program. We are housed in the School of Nursing and Health Professions, and really our mission overall is to advance both the nursing and the health professions education within the context of a Jesuit tradition. And really what we mean by that is that we are grounded in diversity, social justice, leadership, and critical thinking. And we really engage our students and push both our students and our faculty to really, encompass some of the mission, some of the areas in our mission statement. As you might imagine, we have a variety of programs, both for undergraduate and graduate students. And specifically today, I'm going to be talking about the clinical psychology program, or otherwise known as the PsyD, or the doctorate in psychology, that we have at USF. Next slide. Our program is quite unique in that it is completely focused on underserved communities and populations. We have an explicit commitment to both social justice and addressing the inequities in the delivery of physical and mental health services to underserved populations. So really, we expect, and also we specifically have sites set up where students go beyond their coursework material, and we really want them to engage and experience working in the community. And this is both conducting research, doing practicum sites, and some of their scholarship as well in the community. And to give you an example of that, this fall I am taking 7 undergraduate students and 5 graduate students out to do an immersion in the Salinas Valley. I'm doing some work with migrant farm workers, really focusing on community-based participatory research techniques and looking at the health of an underserved population. We will be going out this fall and engaging with the community, providing services and also really trying to understand the social inequities that people are faced with and the difficulty in accessing both physical and mental health treatment. Next slide. All right, so as an overarching goal of the School of Nursing and Health Professions, we really want to promote equity and positively influence both the quality and the delivery of services so that people can have equitable access to care. Next slide. So let's, one of the most common questions we get in the program is, what is the difference between a PsyD and a PhD? And I will briefly outline both of those here. And keep in mind that these are general statements. There are many, many programs across the country. So they're going to you're going to see a lot of variety in both PsyD and PhD programs, but in a general sense, I'm going to highlight some of the differences. PhD programs are typically known as a scientist practitioner model, and really what that means is that you're going to get a heavier emphasis on research as opposed to clinical work. However, that doesn't mean that you're not going to get clinical work in PhD programs, because you absolutely will. The emphasis in a PhD program may, in fact, be more lab-based research. It will provide rigorous preparation for academic careers in psychology, and it also provides solid clinical training opportunities. So typically, PhD programs have anywhere between 2 to 4 years of training, and then of course you'll go on to do your internship and then receive your doctorate afterwards. It will, most PhD programs yield graduates who are license eligible, really to work in a variety of settings. And PsyD programs, you're going to see some commonalities here. So PsyD programs are typically known as a practitioner scientist model. And here's where really the training differs. Here you're going to get much more training in a clinical realm as a practitioner, and then you are going to also indeed get training as a scientist, but that the emphasis shifts between the PhD and the PsyD programs. There is a stronger emphasis on more applied scholarship in community and field settings. So your dissertation, for example, in a PsyD program is commonly known as a clinical dissertation, and you may, for example, do a program evaluation of something that's going on in the community, so it has much more real life implications. PsyD programs are also geared towards individuals who really want to work in clinical settings. You still will have to do a dissertation and engage in scholarship, but really, again, the emphasis here is on practitioner and clinical work. The PsyD program will yield graduates who are license eligible. You can work in a variety of settings, and it also will prepare individuals to work in academic settings. In our particular faculty, for example, there are a variety of individuals with a PhD, myself included, and we have one of our faculty who also holds a PsyD. So it gives you kind of a sense that you could be working in clinical settings or in academic fields, really depending on your interest. Next slide. I want to give you an overview of the timeline in the program. This is a full-time program. It is a full-time program that will take place over 5 years. And this is just a rough outline of what those years look like. So for year 1, you're primarily doing coursework. It is full-time. You also will be taking some credits over the summer. And in year 2, you will see that in year 2, you have 16 to 24 hours that will take place off-site, and this is where you start your practicum. So year 1 is heavy in coursework, where you're really gaining those foundational skills and that knowledge to go out into the field as a practitioner. And year 2, you start your practicum, which is 16 to 24 hours a week, and you'll also be taking classes at that same time. In year 3, You see that you continue taking some classes, although the number of courses does start to decrease at this time. You also have some major comprehensive exams in year 3. So usually programs have what we call comprehensive exams that you must pass in order to advance to candidacy. And those take place in the spring semester of your 3rd year. And also note that you have a slight increase in your practicum hours, where you're expected to be there 20 to 24 hours off-site. And then year 4s and 5, you'll see that in year 3 you begin your dissertation preparation. In year 4 you are doing your dissertation, applying for internship, doing practicum, and with a minimized course load. Next slide. So something to think about in years 1 through 4. You will see that you're going to have 2 to 4 years of increasing clinical practicum. You're going to have roughly between 1,500 to 2,000 hours by the end of year 4. So that when you apply for internship, you have a very solid amount of hours so that you could be competitive for internships. And you're going to see some of these decreases over time. So I'll point you to the last bullet in this area. The program total is approximately 99 to 102 units. Again, this is over a 4 to 5 year time period, and you're looking at about $1,300 per credit. Next slide. Year 5, you have, so in year 4, you're applying for internship. In year 5, you would go into an internship placement. Here, it would be off-site, perhaps out of state. This would be a 40-plus hour a week full-time internship. You would still be enrolled as a student at USF. However, you would be doing your internship offline. This will result in 1,500 to 2,000 hours of clinical hours accrued towards licensure. So in the state of California, you need a minimum of 1,500 hours of internship in order to apply for California state licensure. And I don't know offhand all of the different states, but this should satisfy all of the requirements nationally, but that's something that you should look into if you do want to practice in another state, if you do indeed come to our program at USF. Next slide, please. A very common question we get is the transfer of credits. So we do have several students that come into our program holding a master's degree from a variety of institutions and from a variety of backgrounds. You are able to transfer up to 12 units upon review of transcripts and course descriptions subsequent to admission. So usually the way this happens is if you are accepted into the program, you would meet with your advisor and you would at that point tell him or her that you are interested in transferring some of your workload from a previous degree. We would ask you to please bring in the syllabus and any course material that would allow us to see if indeed it does match up to what we teach in the program. Usually the professor who teaches that course would review the syllabus and any course related material to see if you're able to transfer those credits in. There is no guarantee here, but if you have taken, for example, a culture and mental health course in your master's program, and it's very similar to what we're teaching, you do have a high probability that that class can be transferred in, as an example. So courses must be substantially equivalent to the courses we teach in the curriculum, and this would be assessed by the content expert I previously mentioned. I am getting a question here. Let me just review it very quickly to see if this is something that I can address. Let me go ahead and address that at the end of the presentation, and I'll be happy to answer that question. I wanted to briefly review program accreditation. So we are accredited by the Western Association of Schools and Colleges, otherwise known as WASC. We are also we have associate member status in the National Council of Schools and Programs of Professional Psychology, and we are prepared to seek APA accreditation on a contingency basis, and we actually do. We're very happy to announce that we have an APA site visit scheduled for this November, so we're really excited about that. Next slide, please. This is a sample of some of the community practicum sites that students will have access to during their practicum years. Oakland's Children's Hospital, Prospect Sierra, which is a school, Mills Hospital and Family Clinic, Queer Life Space, Instituto Familiar de la Raza, and this is just a sampling of some of the fantastic varieties of practicum sites that students are available to select as their time here at USF in our PsyD program. Next slide, please. So I want to, before I go into admission requirements, let me go ahead and field the question. So the question that somebody asked is, are there opportunities for child clinical psychology? In fact, there is. So our program does not have a particular child or adult focus. You will see some programs across the country that, for example, accept students into a child track or an adult track. Our program is a general practitioner track, and we have various students who are interested in becoming child psychologists. We do offer, child psychopathology courses, infant mental health. We offer, a variety of courses that will focus on childhood and development. And then a lot of the students that have an interest here pick practicum sites where they are able to engage with children and families so that they gain a lot of experience during their practicum sites. I hope that answered that question. If there's a follow-up question, I'm happy to field that as well. I'm also receiving a question if there's any opportunities for geriatric psychology. And again, here I would respond in a similar way. We don't have a particular focus on geriatric psychology. However, there are practicum sites that are geared towards that population for geropsychology. And then, of course, as part of your dissertation, you can choose to do your work within the geriatric population or the child population, for example, and really kind of carve that out yourself. Okay, so let's return to the slide about the admission requirements, and then I will answer some of those questions. So here, really, I posted our website. So please, if you haven't gone to our website, I encourage you to browse around, look at the different requirements, look up the faculty bios, get a sense of kind of who we are and what we offer, and make sure that this is a good match for you. You must come in with a bachelor's degree from any discipline. We will be asking you for official transcripts. There are various prerequisite courses that you must take if you did not receive your undergraduate degree in psychology. And those are, again, are all listed on the website and include things like developmental psychology, research in quantitative psychology, personality psychology, etc. We do require 3 letters of recommendation, a professional resume or a curriculum vitae, a personal statement for which we have a prompt on our website that you can review and address. We highly recommend that you have a GPA of 3.0 or above. It will just make you a stronger candidate, and that you have taken both the general GRE and the psychology subject tests within the last 5 years. I will also note that there are a couple of deadlines to take into consideration. We have an early consideration deadline of December 2nd, which is coming up pretty quickly. We have a general deadline of January 2nd. And then our interview date for those individuals who are invited to our interview day, that will take place on February 26th of this coming year. Okay, so I am receiving another question here that says, can you speak a little bit to research in the program? I know this is a PsyD program, but the best practitioners are good consumers of research and can use that research and intervention. I absolutely agree, and this is a fantastic program. In some ways, sometimes people think that PsyDs are only clinically based, and that is in fact untrue. I think the individual that posted this question, really has, a really good focal point here, and that is that in order to be good, solid practitioners and clinical psychologists, we must be really savvy consumers of what literature is telling us in terms of treatment and theory development in order to best serve our patients. So that there are a variety of opportunities to engage in scholarship, and scholarship can mean a variety of things, right? You don't have to do laboratory-based work. You could be doing work out in the community. You could be doing work at the Hilltop at USF with undergraduates. So there's a variety of ways that you can engage in research and scholarship. And we welcome that. All of the faculty have active research studies going on, and I highly encourage you to go to our profiles and read about some of the work we're doing, look up some of our literature, and feel free to reach out to the faculty if you have interest in our area of study. Okay. I'm receiving another question here. Students with master's degree need to take a PSY subject test. So everyone coming in is required to have scores for both the general GRE as well as the subject GRE. So yes, that is an expectation, and that is part of your application materials. Another individual is asking, what if I already have a master's degree in the related and/or medical background? Will I be eligible for a waiver of some credits? So yes, and it depends. So one of the things that you can do is you could look at our curriculum, which is available online, figure out what classes you might consider transferring in, and then once accepted into the program, you would sit down with your designated advisor and review that. We would again ask you to bring in your syllabi for those courses, and then a content expert would review the syllabi you bring in and let you know if you are indeed able to transfer units. As a program in general, we have had various students transfer in courses, so that would kind of that would be the process for engaging in that particular area. Okay, and we have another question here. I'm currently working on a master's in psychology, which will cover the prerequisites needed. However, I won't be done with the program by the application deadline. My undergrad is in criminal justice and I have a law degree. Can I still apply? Absolutely. one of the things that you could state in your application is, your wonderful background that you've indicated here. I think that, again, I think that all of these things have such an intersection with psychology that it would be, really great to have you come in with that experience. And one of the things you can note in your application is that you are currently in a program, and you could tell us which courses you are going to be taking, and that if admitted into the program, you would have satisfied those prerequisites with a B or higher for acceptance into our program. Okay, next question. In admissions, you have deadlines listed for early consideration and general consideration. What are the benefits and reasons for early application? The benefits are that we will review your application much quicker, and you will hear from us in a timely fashion. This is particularly important for students who may be applying to various programs, and that way you have a sense of offers that are coming in for you, and this will help plan perhaps your travel. If you're traveling for a variety of interviews, it may assist you in kind of coordinating some of that travel and just give you an idea of what programs you have an invitation to come and interview at. Okay, next question. If a candidate applies with a GPA on the lower end, what are ways that they can make up for this? Do letters of recommendation weigh more, the statement, or clinical experience? One of the things that we really focus on in the program is looking at a holistic application. So let's say, for example, that we have a candidate that for one reason or another is applying to our program with a low GPA. Tell us about it in your statement. Tell us, was there a particular situation going on in your life? Did you perhaps, have a low GPA starting out, but then we see your grades pick up? So, definitely feel free to address that in your statement and give us a sense of, who you are and why that may not be reflective of your academic abilities. I think that would be probably one of the best things to do. Letters of recommendation are incredibly important, right? So that's something to take into consideration. Your statement is also very important, as well as your clinical experience. So all of these things are important, and what I'm trying to highlight here again is that we really look at applicants in a holistic way. We're not going to look at one piece of your application without taking into consideration kind of the whole picture. So the more you can address kind of who you are as a whole person in your statement, the better sense you're going to give us of what type of applicant you are. So again, I invite you to address some of those things in your statement. Make sure that you ask people, for strong letters of recommendation.
We may have lost Dr. Garcia. Dr. Garcia, if you can hear me, we lost audio from you. We'll wait a couple of minutes.
Carolyn, can you hear me?
Oh, now I can hear you. Yes.
Oh, I wonder what happened.
Not sure, but you're back on though.
Okay. Can you tell me what was the last thing you heard, and I'll try to pick up where I was lost?
Yes, it was actually, you just started to answer the previous question, your last question.
Okay, so about the letters of recommendation and statements?
Yes. Yes,
Oh,
absolutely.
okay. So I answered it. I don't know how much people heard. Um, but what I was answering here was that really all of these pieces are all important, and that we really take a holistic approach to the applicants. So we really want to see, your GPA, your letters of reference, your personal statement. So really address that thoughtfully in your statement. If indeed you have a low GPA for a particular reason, make sure that you address that. And the last thing that I was saying, I don't know if people heard this, was that we have the question about if you need to come in with clinical experience. We have a variety of students with a variety of backgrounds. Some people come in with very, very little clinical experience, and some people come in that maybe have held MFT who have extensive clinical experience. Both students are welcome into this program. So you do not need to have clinical experience. That's something that you will pick up along the way. And if you do have clinical experience, that's also great, right? You can continue to hone some of those skills and be open to new experiences. Okay, I'm going to move on to the next question. Are the deadlines generally the same each year? I am thinking of applying for the 2019 academic year. Yes. So those are, roughly going to be the same every year. The one thing that I will also address that I didn't put in the slides is that we do have a diversity scholars application cycle. So if you are a student of an underserved community or of a particular ethnic background, and again, you can read up about this on our website, you could apply as a diversity scholar, and if chosen, we are able to offer you some funding to assist with travel costs and things to that extent. So I encourage people that if you do fit any of those requirements, that you read up on that and apply it if you're eligible. The next question: are we eligible for a fee waiver? And I'm not sure what you mean by a fee waiver. Could this person please clarify? Do you mean when you're applying, or do you mean during the program? If you can clarify that question, I'll do my best to answer it. Okay. I'm also getting another question, which is, what is the difference between the 2nd December deadline and the 2nd of January? So again, I think somebody asked a similar question earlier, and really what this, what the difference in these deadlines is that you will get considered sooner if you meet the December 2nd deadline. You might hear from us sooner, so that you could also plan ahead and plan accordingly and kind of, coordinate your efforts a little bit more. This is particularly useful for individuals who may be planning to apply to a variety of schools. If you apply sooner, you will likely hear back from us sooner, and then you're able to get a sense of the variety of programs that may be inviting you out for an interview. Okay, I hope that answered your questions. Please don't hesitate to ask something else. I'm happy to answer the questions as best I can. And again, if there is something that you ask that I can't answer right now, I'm happy to find that out and get back to you as needed. And I just want to thank you again for logging on and listening. And again, I will refer you to our website. Don't hesitate to reach out to any of the faculty for questions. And I have a contact here as well. So Dr. Michelle Montagno, which is who is an associate professor and also the director of our program. She will be serving as the admissions committee chair for this incoming year. if we can't answer those questions, we'll direct you to somebody who can. So I look forward to seeing your applications, and I wish you much success as you figure out what programs to apply to, because it is a very important step in your career.
And I'd like to thank you, Dr. Garcia, for a wonderful and informative presentation. And again, just thank you to all attendees out there. And I did want to note that anyone who is listening and who has attended will be receiving an application fee waiver. So I know that there was a question earlier about a fee waiver, and if that person who asked the question was referring specifically to the application, then anyone who is attending now will be receiving an application fee waiver.
That's fantastic. Thank you for clarifying that, Carolyn.
Yes, absolutely. And thanks to, again, thanks to everyone for attending, and we hope that you all have a wonderful day. And if you have any questions, please feel free to contact us.
Thank you, and have a good rest of your day.